With that, I want to turn it over to our first presenter, Michael Elliott, again, Senior Vice President and Chief Transformation Officer with Centra Health, covering the region. And what I'm going to do is share my screen. We'll pull up Michael's presentation, and we'll turn it over to you, Michael, for the latest information on COVID-19.
Thank you, Scott, and thank you for the opportunity to speak with this group this morning. We are here for our community by all means, and we're looking for any avenue to get out information, to dispel myths, and also share really what focus areas we need to have now and likely well into the future. So I'm going to try to be brief this morning and hit a couple of high points. I hope that some of the things that I share this morning are repetitive because that means we're hitting the right topics and we're hitting them over and over again. Part of what we're seeing is that we have to stay consistent on some very simple and straightforward measures that can have a huge impact. And so you will hear these things repeated over and over again, and we're going to continue to hammer them until everyone tells us, stop, we've got it. And then once that happens, we're going to do it for another month or two because these things are that important. So we can go to the next slide.
Yes, sir.
So first off, by this point in time, most people have heard of that term, flatten the curve. And you've likely seen several pictorials of this. This is my favorite thus far because it doesn't just speak to overall flattening the curve. It speaks to what happens in your own community if we don't flatten the curve, and then what happens if we do. And this is playing out in places such as Italy. This is playing out in places such as New York and other parts of our own country. Well, here's where I want to orient you. On our y-axis, we have the number of daily cases. On the x-axis, we have days since first case. And then we have our large without protective measures. You can see from a healthcare system capacity, now this is a generalized graph, but it works for most communities. Without taking protective measures, without heeding social distancing, without heeding what the governor has put forth as a stay-at-home measure, it is undoubtedly and has been proven you will outstrip the capabilities of your local health system without doing those things and doing them effectively. When those things happen, those are the situations where you have heard people having to make decisions on who gets a ventilator and who does not. At the end of the day, making life and death choices. We do not want to get anywhere near that. And so we must continue to take these social distancing and stay-at-home measures seriously. With protective measures, you can see that we can stay within the healthcare system's capacity and therefore treat everyone at the level at which they expect to be treated and do the best for our communities that we can. Next slide, please. As of yesterday, if we would have looked at this pictorial a couple of days ago, you would have seen more white spaces on the state of Virginia out to the west. Essentially at this point, there are more counties and cities within our great Commonwealth that have confirmed cases of COVID-19 than do not. The expectation is that all counties will at some point through testing have confirmed cases. These numbers have been updated as of just about 30 minutes ago. And so the number of people tested has risen from 17,589 to just over 19,000. The total number of confirmed cases has risen from 1,706 to 2,012. The number of hospitalizations have risen from 246 to 312. And then the total number of deaths due to COVID-19 has risen from 41 to 46. On this slide, you can see the number of cases based on the color coding there. And obviously in our more populated areas are the higher number of cases, with Northern Virginia really being sort of the hot spot, as one might expect. Once again, getting back to social distancing, there's all sorts of information coming out. But another thing that came out just last evening is a look at where people are actually taking heed of social distancing and stay-at-home orders, and where people are not. New York Times published something last evening. What it shows is, through cell phone data, we can tell if people are traveling or not. Red spots show that people are traveling. White spots show that people are actually staying at home. For the state of Virginia, actually in Northern and Eastern Virginia, those sections appear to be white. People are actually heeding the measures to stay at home. As you go further west in our state, there's more red. There are fewer cases, and therefore it appears that people are not taking stay-at-home measures as seriously as possible. I am here to tell, ask, and plead with everyone to please stay at home, if at all possible, other than for essential matters. It is important, and lives are at stake. Next slide. So I wanted to give a look as of yesterday at cases around the Bedford area. If you add these up, this is approximately 50 confirmed cases, but don't let these numbers not only surprise you, but also lull us into a sense of security. These are the confirmed cases from a testing standpoint. We know for a fact that everyone is affected by COVID-19 a little bit differently. There's undoubtedly people who have had COVID-19 with very mild symptoms and have gone through the course of that disease. And there are others who have the disease right now who have not been tested and are infectious at this point. These are only the number of confirmed cases. And we expect that those numbers will go up over time. Next slide, please. This is my final slide, and I want to spend a little bit of time here on these areas because this is not only what's happening nationally, but what's happening locally as well. We continue to focus on personal protective equipment, also called PPE, and medical supplies as well. We are on calls daily at the state level as well as at the national level. I'm happy to say in our region, in our healthcare system, we are well off and better off than most other health systems, frankly, around the country, from a personal protective equipment and medical supplies. While that is the case, we are also not in a place where we feel like we've got it made. Once the number of patients begins to continue to increase, we can burn through personal protective equipment and medical supplies extremely quickly. So we are working every day, all day, to continue to secure PPE and medical supplies. And I want to send a thank you out to the Bedford community and surrounding areas for all the donations that we have as well. Please do not stop those donations of PPE from coming because we are in this for the long haul. Secondly, testing supplies. Nationally, you will have heard that there are lots of issues with testing supplies as well for COVID-19. Just like the personal protective equipment and other medical supplies, we are well off and better off than most. However, we do not have an unlimited supply of testing supplies. So we are continuing to source those things, and we'll continue to follow guidelines on testing that are appropriate. Third, predictive modeling and demand matching. I'd like to share that there are numerous models that are being referred to. The President's Task Force on COVID-19 usually refers to a model coming out of the University of Washington in Washington State. And that modeling is at a national level, but you can also get down to a state level as well. A couple of things to point out about that modeling. That modeling shows that the United States is going to peak likely in late April, as far as the number of cases of COVID-19, and then also the number of people hospitalized. It's interesting enough, when you look at Virginia, Virginia is going to peak several weeks after that. Virginia is thought to peak in mid to late May. So that will be extending our time, if you will, based on those models. With that, we are matching up our supplies. We are also continuing to do things like canceling all elective procedures and keeping our capacity available in our hospitals and clinics so that when things do hit the high points, we're able to efficiently care for patients. Last and not least, I want to send a thank you out to all the caregivers within Centra and outside of Centra in the Bedford area. You've got great leaders. You have Bill Bass, you have Georgianne Watts and the team at the hospital. You have the clinicians out in our clinics as well. They're doing a great job. They're ready, and we're ready to take care of the community. So that's my overview. Thank you for allowing me to give a little bit of insight as to what we're thinking right now, and for hearing my plea to please continue to social distance and also encourage people within your organizations as well as family and friends to stay at home if at all possible. Thank you. Over to you, Scott.
Thank you, Michael, very much. I greatly appreciate, as I'm sure the rest of our audience does, the information that you provided, especially the updates with the latest numbers. I think that, you know, especially in times like this, we are kind of nervous, and the worry is driven by not having information, by not knowing. So between the visuals and the numbers that you provided, that was wonderful. I'm sure we'll have some good questions around that as well. And we appreciate you being here this morning to spend this time with us.
Thank you, Scott.
Again, thank you. The next speaker that we have with us this morning is Tracy Bledo, as the Director of Economic Development for the Bedford County. I don't believe, Tracy, you have any particular slides for us, but we just wanted to spend some time hearing kind of the latest and greatest from the economic development perspective, and perhaps some of the financial aspects of this for businesses. So I'll turn it over to you.
Thank you so much for having me. I just first of all want to say that our business community has been outstanding. I've seen so many success stories on how manufacturing and professional service and others, retail, restaurants, so many people coming together to find solutions, to find ways to work around this situation in the most safe manner possible. I can tell you that our county government is taking this extremely seriously. We shut down our building a couple weeks ago, but we've continued to meet in the way that we're meeting right now, developing a task force, helping citizens. You'll hear from our sheriff soon on that. Today is the day that our businesses are going to be applying for various, what one person, I think Senator Kane said, groans. They're loans that certain parts or all will turn into grants if employers are able to keep their payroll or bring their payroll back. So I've been really happy to see that a lot of our manufacturers have remained open. There's some that have gone ahead and shut down because maybe their retail shops, if they were producing something that went to retail, the retail shops had closed. So they can produce all they want, but if they can't ship that product, they, you know, that stuff can't just sit there and they can't just keep producing. So we've had, each one is a different case. A couple weeks ago, your local economic development team, myself with Bedford County, Pam from my office, Pam Bailey, who leads the legislative committee for the Bedford Chamber, does a great job. And we got together with Mary Zirkle, who's on this call as well, the town economic development person, and we just said, you know, what can we do? Well, all we could do at that time 2 weeks ago was to, on Monday, start calling our companies and go down the list one by one. And if we haven't called some of you that are on this call, you can reach out to any of us. You can go to bedfordeconomicdevelopment.com and you can see our staff information, and then of course Mary Zirkle, I think Better in Bedford, you can find her there. And we're here to help guide you, but a lot of the businesses today are going to be focused with their banks. And so, you know, say a prayer or some thoughts for your bankers, because they're going to, today was the day that they're able to submit the applications that that are coming in and get those done. So this next week will be a lot of applications for the loans through the disaster loan program and the EIDL, as well as the PAYCHECK program, the PPP. So it's a lot of different terminology. There's also bridge loans, there's bridge, all different types of things. So if you go to bedfordeconomicdevelopment.com, click on the red bar at the top, COVID-19 resources, and we just provided a bunch of links there that will take you to where you need to kind of review. I had to kind of laugh a little bit when I saw an article that Generation X, you know, that I'm a part of. Yes, I'm that old, but many of us are, this is our time that, you know, we were latchkey kids. We know how to take care of ourselves, and we would come home after school and we would fend for ourselves during that time. You know, it's a little different for the millennials that had the helicopter parents, but we will get through this. And if we can help others kind of navigate how they can get through it as well, I think that will go a long way. So at this point, what I'm doing is focusing on helping people apply for unemployment if they're in that situation. Hopefully it'll be temporary if they are, and helping our companies know if they should apply for a loan, and if so, for what reason and how much, and all of that. So again, I'm available to help answer questions. Pam and Mary are too. I know that on this call we've got Dawn Dehart, and I don't want to continue because I know that she needs to get through and talk to some of these 30 some or 40 people on this call, many of which will want to apply even as early as today with their local banks that are approved lenders with the CARES Act. So without further ado, I'm going to pass the baton on to the next speaker so we can get on with some of that. Thank you.
Tracy, thank you very much, and greatly appreciate that as well. It's the first time I heard the expression around the loans. So it's good to hear that you know, the support mechanisms are thinking about that to make sure that if people are able to bring their workforce back, that's going to turn into a grant. That's great news. And as a baby boomer, I'm just trying to figure out the technology, much less anything else going on with this whole adventure. So thank you. And with that, let's actually turn it over to Dawn Dehart, Senior Vice President at Carter Bank and Trust and Director of Community Development Lending.
Okay, the economic injury disaster loan, that was the first one that was announced under the SBA's disaster loan program, probably now about 2 weeks ago. We do have some, we're aware that several business applicants have made application through that program. It is truly a loan program. It's debt related. So don't confuse it with the other one that's the Paycheck Protection Program. Under the Economic Injury Disaster Loan Program, businesses can qualify for a loan up to $2 million, and the term of that loan would go up to 30 years. It's eligible to not only small businesses with employees, with 500 or less employees, but also nonprofit organizations, and this is a very unusual aspect of the program. Traditionally, the SBA only provides financing for-profit businesses. In this case, they've expanded the net to include nonprofit organizations because the economic impact has been so widely dispersed. It affects everybody in the community, including our charitable organizations and so forth. And agricultural cooperatives are eligible as well, and that's an unusual program feature too. If a business applicant does apply, the SBA will determine how long that loan is based on the financial records that are submitted. So if a small business is awarded a loan, their rate would be 3.75 fixed for the term of the loan. And for a nonprofit, it would be 2.75% fixed for whatever the term of the loan is. The use of the funds through this loan program would be used to pay payroll, of course, supplier debt, and even payments on existing loan obligations that business owner has right now, pre-existing debt. This is a direct program between a business applicant and the SBA. The business owner does need to apply directly to the SBA.gov website. And because there are a lot of financial records that have to be uploaded as part of that application, SBA as well as other lenders are encouraging the business owners to take advantage of the Small Business Development Center technical assistance. In this area, of course, that's Stephanie Keener, who does a wonderful job. But she can assist with the packaging. And the intent here is to make sure that, you know, there's some support in helping the business owners provide all of the correct information right up front so that they can get an immediate answer. So I think that's all the overview I'd like to do on the Economic Injury Disaster Loan Program. Let's move to the Paycheck Protection Program, since that's getting all of the attention today. This is the program, of course, that has a loan forgiveness component to it. Last week, Congress approved $349 billion, which they allocated to support the funding need in the communities. And it's designed all around payroll. The intent here is to use the funding here to keep people employed. You know, we think this virus pandemic period maybe another 8 weeks or so. So this is sort of a short-term lifeline to help employers and their employees get through the next 8 to 10 weeks and avoid any layoffs. The program would cover 8 weeks of payroll, including employee benefits. And again, just like I reviewed with the Economic Injury Disaster Loan Program, eligibility is very, very broad because this pandemic affects everybody all over the country. No matter, I don't know of any industry that's not affected by the shutdown. Eligibility is a small business with 500 or less employees. There's also a mid-range where businesses with over 500 employees in some industries can be eligible. And I'm thinking franchise like hospitality industry and the restaurant industry and so forth that have multiple locations and numerous employees. Nonprofits are also available, are eligible for this program too, in addition to veteran organizations, tribal concerns, sole proprietors, and independent contractors. So you can see there's a huge, wide net to try to capture everybody to get the funding out there and keep the economy going. Okay, and so the terms here, there's been a lot of back and forth over the last week, which you know, accounts for a lot of the scramble in the banking industry. We weren't sure. A lot of the, I guess the early press talked about the term being 10 years, the rate being up to 4%. There were last minute changes, even last night, to the program. Earlier this week, the rate had dropped to 0.5%. And as of last night, the interest rate is now 1% fixed for the term of the loan. The maximum term for borrowing under this program is 2 years, not 10 years, which is what everyone was seeing a week or two ago. Absolutely no fees to either the borrower or the lender, no personal guarantees, no collateral. This is all unsecured debt. And of course, the use of the funds would be applied to support payroll, any interest payments on a business mortgage. If that particular business owner has a rent payment, has a lease instead of a mortgage, the funding would cover the rent payment. Utilities, in addition to interest payments on any other debt that was incurred prior to February 15th of this year. Payments get deferred automatically for 6 months. There are no prepayment penalties. And in this case, how the loan would be sized can actually be done by the business owner. It's basically an average payroll times 2.5. So if you've got a company whose annual payroll is 120,000, then that average payroll each month is 10,000, and take that times 2.5 times, and that's a $25,000 loan. Although for larger industries, the mid-sized industry we talked about a little while ago, these loans can go up to $10 million. The SBA normal maximum is $5 million. So the SBA in this case is trying to eliminate all of the barriers and cast that wide net so that everybody can apply, including sole proprietors and independent contractors and nonprofits. And the program availability is designed to go through June 30th, which hopefully will be the end of this virus period. Who knows? But it's widely thought that this money is going to go very, very quickly, and Congress may have to go back and do a second tranche. So I think that's actually what's going to end up happening. Let's go to the next slide here. Application process 2, SBA has tried to greatly simplify that. We're all accustomed probably to going into a government website and making an application. Typically, there's a lot of bureaucracy around it. In this case, it's a very simple, basically one-page application and a one-page certification. There's no underwriting, there's no financial analysis. All the borrower has to do is go into a website at wherever the bank is that's handling this program, so fill out that application, sign the certification, and provide the payroll records. All of this funding is exclusively tied to the average payroll for that business. And then at some point, 8 to 10, maybe 12 weeks from now, that business comes back and they're ready for loan forgiveness. And this is where people call it a grant, so to speak. The applicant will come back to the lender and provide the payroll records for that period of time from the loan to up to the point when they're applying for forgiveness. If there is no change in the number of employees between the loan origination and the time of the forgiveness request, then there's 100% loan forgiveness here. In some cases, an employer may have had to reduce the number of employees, and so the loan forgiveness portion gets prorated, and whatever is left over becomes a loan for 2 years at 1%. And in some cases, they may have had to reduce some of the wages for those employees. The head count may remain the same, but the average wage per employee may have gone down. So if an individual employee's wages have gone down by 25% or more, that loan forgiveness portion would get prorated, and then there will be a residual carryover that becomes a loan at 1% for 2 years. And so there's still a lot of developments under this program, hence that mad scramble to make sure that the banking community is ready. There are going to be some more webinars going on there. I don't know if anybody has seen any of these webinars on the SBA.gov website, how to apply for some of these loans and so forth. There are a lot of resources out there, but understand Treasury and the SBA are still wrapping their arms around all the technical aspects of, there's so many questions coming up. What if I'm a business owner and I use a management company for my staffing needs rather than having the employees myself? What does a payroll record look like? That may vary from business to business. So lots of questions like that we're all trying to scramble to answer. And I would encourage you to get some questions in to me, and I'll personally try to solve some of those answers. And my next comment would be, I do not intend this to be a commercial for Carter Bank. Some of the banks that we understand will be participating in this Paycheck Protection Program are only going to serve their customers, whether they be loan customers or deposit customers. Carter Bank is embracing everyone that wants to apply. We feel like we need to support the entire community. So you don't have to be a customer to apply to Carter Bank for this Paycheck Protection Program. We have a link on our website, carterbankandtrust.com, and there's a banner that you check under Paycheck Protection Program. At the moment, as I understand it, a business owner will go in and register right now and for an alert. At some point today, the banking industry will be able to start accepting applications. That's not the case at the moment. All you can do right now is register, and you'll get an alert when the website actually becomes active to start accepting applications. And we're encouraging business owners to get all of their payroll records together so that the moment that that application opens up, you'll be ready to submit your application and your payroll records. And then hopefully get a fairly rapid response, but understand there's going to be a lot of volume in this program. We're using a third-party processor to help us with the volume rather than trying to build the infrastructure internally. We feel like there's so much need out there that there are going to be capacity issues. So we've enlisted the aid of a third-party processor to help us with that volume. So that's my overview of the program. I know it's more of a teaser at this point, probably, as everybody gets comfortable with the guidelines and how to administer the program. But I'm always interested in feedback and any questions you may have that however we need to support the business community, we're willing to step up and do that.
Dawn, thank you very much. That's tremendous information and very, very important. I think a huge thank you goes out to Carter Bank and Trust for being there for the community, whether they are your customers or not. I think that says a lot about the organization and the people that lead that organization. So thank you in advance. Greatly appreciated. And certainly more information coming and very, very helpful. So we appreciate you being here. All right. We have our last but certainly not least speaker of the day, Sheriff Mike Miller, native of the county. He's been with the department since 1985 and has some interesting information around some of the services being offered from the Sheriff's Department. And let me pull up that presentation and Sheriff, you can take that away.
Well, first off, we want to thank you guys for inviting us here this morning, and good morning to everyone from the men and women here at your Sheriff's Office. One of the initiatives that we started looking at when we started hearing our governor tell us about being home, stay at home, is coming up with a way that our citizens can get more involved with their questions. We see that when the governor has his press conferences, there's new rules, laws that are coming down. So about 3 weeks ago when this started, we came up with our initiative, which is called the Bedford County COVID-19 Response Call Center. This initiative was started because we wanted to be able to address our citizens in the most positive way as possible. So the mission is to attempt to curb the anxiety of our citizens and to help our 911 operators to continue to accomplish the great work that they're doing and not being overloaded by the non-emergency calls. So how does this work? A representative from the Bedford County Sheriff's Office, along with staff from other Bedford County departments, staff that center from Monday through Friday from 9 to 5. The phone number is on your screen at 540-587-0720. A voicemail message will also be set up on the phone for people calling either before 9 or after 5 p.m. and we will return those calls, is what we will end up doing. In conjunction with our call center, an email address was also established. It is on your screen now as COVID-19-bedfordhelp@bedfordcounty.va.gov. After hours, you may also leave a message on our website on this email address. And we would ask you, if you're calling in, to leave your name, a phone number, and a brief description for the reason that they're called, so we can expect a call back or an email be returned. What we decided back on March the 20th, as you see on your screen here, we hosted a meeting with our leaders in Bedford County's faith-based community. So as we looked at our map of our county map, which we have in our EOC room now, the call center, we picked out certain churches throughout our whole community, and we're able to bring them together to be able to ask them about, one, what's going on in their community, but two, being able to come up with a donation or distribution points throughout our whole county for especially our senior citizens who are sheltering in place at their homes and who have limited options for getting food or medications delivered. So as we spoke to those faith-based community, we were able to come up with different areas in our county. So we have that covered now. Their job was to go out and to be able to bring in other faith-based communities, other churches, to be able to have a big distribution point or a delivery system set up for our citizens in our county. So providing that liaison for the sheriff's office was able to process for local churches and being organizing and facilitating our program. On March the 23rd, so that was Friday on the 20th, on the 23rd, we also held a meeting with our leaders of our infrastructure businesses like Walmart, Kroger's, Food Line, Dollar Generals, our pharmacies also. And we were able to find out from them if they were able to continue to stock shelves. Was there going to be a food problem, a food shortage? And they told us, and really probably the best answer was no. There was no food shortage. There will be none. Pharmacies have plenty of medicines. So we were able to secure ourselves that way. It was just how can we keep our shelves stocked? So we have built Sergeant Neal with the Sheriff's Office has established and provided a point of contact for these organizations to ensure that they have a significant distribution in service and to allow law enforcement to keep an eye on the availability of their supplies on a long-term basis. As well as businesses, as I said earlier, with our pharmacies, they also attended our meeting, and it was discussed a plan with them to be able to make sure that our medications were being able to be there in our pharmacies for our citizens in Bedford County, and it was. So what we have done now through the Sheriff's Office is we kicked it off Monday with our call center, and with, as I said, with other departments within our county. We're able to receive phone calls, emails, and we're able to address the questions that they're asking us is what we're able to do. As of yesterday at 5 o'clock, we had already received over 100 phone calls through our call center, which is really kicked off to a wonderful start for our citizens. So what we're asking now is from our local businesses is to make sure that you all will continue to put this out there to your employees to be able to call us and let us know if they have concerns, if they need something, especially our senior citizens. What we're also asking is if there's anyone that wants to help donate or to be able to work with our food banks. At the Sheriff's Office, not only are we manning the call center, we're also working with our food banks to distribute and deliver food for them. We're also calling on our senior citizens. If you know someone in your community that just needs a phone call, yesterday from 10 to 11, I personally ended up calling 11 people. We have assigned different seniors to our officers here and our command staff. So on Thursdays, we make sure we do that phone call to see if they need anything, and we will run that through our call center is what we end up doing there. So let us know if there's anyone in your community that you need checked on, and we will be more than happy to do that for you. And also, if you would, please, family, friends, and neighbors, make sure they understand about the scams that's going to start and the frauds that's going to start out here. We've already had 2 calls in about people they've been receiving calls on scams. So we're trying to educate our public as much as possible to give us a call at that number. We'll let you know if it's a scam or not, because we keep up with that along with all the other jurisdictions. So please let us know if anyone is receiving scams. And for our businesses, you know, we've educated our Walmarts and our Dollar Generals and everyone else. If someone's coming in there and asking for a large amount of green dot cards, blue dot cards, different things like that, to let us know if possible. We do know that there's a violation there with personal information, but we've educated our clerks too that's probably going to be a scam. And so we hopefully can stop that is what we can do before it gets started, because it's, as you guys know on this, it's a really hard case to prove because most of them are out of the country. and we have to turn that over to our federal partners. So with that said, I'll be quiet and wait for some questions if you have any.
Sheriff Miller, thank you so much. It's greatly appreciated. And I think what a wonderful service that you and your organization are bringing to the community of providing a place for folks to call rather than going through the 911 and perhaps tying up that system so that people with an emergent situation can get through. So again, thank you very much. With that, I'll turn it back over to Wendy to maybe cover a couple of questions as we finish up our morning here. Then give us a little update for what's coming next week.
Sure, I'll be glad to. I do want to just thank all of our panelists for today, for answering questions that people had, covering these issues that are really needed for our community to find out more about the financing available, what's going on in our community, the phone numbers that people can call in to get the help that they need. We are just bringing it today. I mean, thank you for our panelists who are on it. And we just appreciate you hardworking individuals who are really highlighting what our needs are and taking care of them. So thank you for all that you're doing every single day to help our community and our businesses. So we're going to take a couple quick questions so we can finalize this call. We want to take one for Michael. Michael, if you're still on, this one is from Erica, and she wants to know what is most needed from our community right now. Items, donations, blood donations, what can we do as a whole to be most effective? And this is a community question from Erica.
Thank you, and thank you for that question, Erica. I'm going to break this down into 3 buckets, and I want to emphasize the first bucket. The absolute number one thing that we need is for everyone to practice social distancing and to stay at home. We've all heard that saying, an ounce of prevention is worth a pound of treatment. It's true. So rather than having people have to come to our clinics, have to come to the hospital with COVID-19, if we can get upstream and get really, really serious about staying at home and practicing social distancing and practicing good hygiene, that is absolutely by far the number one thing that people can do for Central Health and the rest of our community. Secondly, as I mentioned, if you are within an industry that has personal protective equipment, surgical masks, N95 masks, gowns, latex gloves, anything that you can spare, we would happily still take those donations. And then third, I'd like to call this isn't PPE, this is PPP. So number 1, continue to pray. Number 2, continue to praise those who are out on the front lines. And then either publicly or privately, reach out to those that you know are first responders, essential personnel. A phone call, a text message goes a long way these days, as people are truly concerned not only about doing their jobs in an excellent way to care for the community, but people also have to take the burden of wondering if they're taking home with them COVID-19 as well. So continue, we're in this for the long haul. Those text messages, those messages either posted on social media or reaching directly out to essential personnel and first responders and healthcare workers, not just today, not just next week, over the coming weeks and months. So I hope that answers your question, Erica. Thank you.
Thank you, Michael. We appreciate all that you're doing and all that Centra is doing to help our community stay well and stay healthy. And also, I do want to interject that the Chamber here on our website, we are posting business needs and healthcare needs. So if your business has a need, please let us know and we'll put that out there on our website so other businesses can help get the supplies to you. And so we are business to business helping each other. All right, next question is from Chris, and wanted just to kind of a broad statement. If you have employees that are essential, do they need documentation to travel to and from work right now? And this question could go to the sheriff or HR expert, Rachel, on the call, either one.
Well, from the sheriff's office standpoint, no. We're not pulling over vehicles just because they're out there. We also received a brochure from the state police yesterday. They're the same way. So we are not pulling over vehicles just to see who's going back and forth. So right now, you know, the law is still the law. We still have to have reasonable suspicion and probable cause to do that. So it's nice if you have it. I'm sure there's a comfort to that, but just to assure everybody, law enforcement's not out there pulling people over for that reason.
I would have to second that. We checked with our legal as well. This is Rachel Tobin, Human Resources Director at CSE. We actually have employees who travel into Virginia for work that live over state lines in North Carolina and West Virginia. They do have curfews, and when they go back home, they just felt, as the sheriff said, more comfortable. So we have made that letter available to them, but we did tell employees it is not necessary. They will not be pulled over in the state of Virginia, but in some areas outside of the state where they travel back and forth to work, they do have curfews.
Thank you, Rachel and Sheriff, for that. We appreciate that. And we do have, I want to say, as a chamber, we're going to have up on our website continuity plans, templates, crisis plans, and then we will also put a generic letter template that you can have and use that for your needs, for your business needs. Also, one last question for Dawn. With the PPP plan, how soon can businesses, so if they do apply for this, how soon will they get a confirmation that they have, that you've received their application? We know the money, we don't know how long that's going to be, but as long as they kind of know, when can they receive the confirmation?
Is an approval? That's
Yes.
probably what you're asking, I think.
Yes.
No.
Okay.
I don't think anybody's website is up and running in order to accept applications. We fully believe that'll be later today. And it may vary from one lender to another. I think as soon as an application is entered, there will be a confirmation and I believe a loan number or a confirmation number that they're in the system. We don't know yet how long it may take to get an approval. At some point, it's supposed to be same day. That will not happen today, I'm sure. But I would say within a couple of days. This is so new, we just don't know. But I do think that there will be a confirmation as soon as someone hits submit with their application and uploads their payroll records. And hang on to that information because I think it'll produce a confirmation number for future reference. As soon as we have some sort of track record, I'll be able to give some guidance on that. I wish I could answer that today.
Well, it's still unfolding, so we appreciate all that you're doing and keeping up with the information, and we'd like to have you on again for sure in the coming days ahead. I want to announce who will be on the call next week, Friday, same time, 9:45 on April the 10th. Of course, we're going to have our fearless leader again, Scott McCarthy, StyleWise Partners. He is going to talk about leadership development, and that is going to be very timely. We're going to have Sheriff Mike Miller on again and give us an update of what is going on and different things that we can do to help. Craig Sanowski with Fifth Order Technologies. He's a tech expert, and we're excited to have him on to talk about some Zoom, how to use it, some different techniques. And so that's going to be wonderful as we all learn new techniques during this transition. Jamie Reynolds with FinTeam Business Consulting will come on, and he's a business consultant and certainly well needed right now for our businesses to learn how to keep up with what's going on right now and how to financially navigate through these times. And then, of course, we want to have Centra, Michael Elliott back on. So we'll definitely continue with our panel experts, the dream team right here. And we thank you for your expertise in your field and bringing us that knowledge. And on behalf of our board, Members, everyone, we thank you for your membership, and please continue to pop on these calls because we want to bring you the latest and greatest information so that you can navigate through and strategize ahead. So bring you out of the crisis mode into recovery mode. That's what we're here for. We are here for you. So thank you again, and please be safe, stay healthy, and we'll look forward to seeing you virtually next week.